Hi, everybody. I see some of the usual suspects.
Oh,
Good morning. Good morning. Is it feeling like summer to anyone yet?
yes,
Is it down there, Shots? Is it hot?
it is. It's not, yesterday it was in the low 90s in Paula, so not quite so hot today, but I'm going to the baseball game tonight, so I'm just like, yay, baseball.
Padres.
Now the Padres would be in first place if the Dodgers weren't better. Stupid Dodgers.
We hate the Dodgers.
Yes.
Yeah, so that's.
If you grow up in San Diego as a Padres fan, you hate the Dodgers, but Dodgers fans are just sort of indifferent to the Padres.
Well, and in Northern California, we hate them too.
Yay.
San Diego and Northern California could form a alliance. Well, I think we're going to get more folks. It's just kind of really at the top of the hour. So why don't we let folks roll in? But my special slide today is that this is meeting 12, which means happy anniversary. And I want to thank you guys for continuing to come. Like I said, it's one of my favorite meetings. We missed last month, obviously, but this is technically our 12th, but we actually started June 9th, 2021. So we've been meeting ever since. Oh, we're getting some more people here. So just a big thank you. I think we said everybody should bring cupcakes this time. If I could give you a cupcake, I would. All right, so let's kind of remind everybody what we're here to do together today, and then we'll do a little bit of introduction and we'll move on into our agenda. So as always, this group comes together about monthly to connect national climate and health data experts and invite us all to exchange our knowledge on tribal adaptation and resilience data needs, share tools, best practices, ideas, and lessons learned from the field, and explore opportunities to develop and scale up solutions to address tribal resilience data needs. And so we are super fortunate today. We have folks from the Healthy Places Index, which is one of my favorite tools. And they just make a pretty tool, and they have lots of really good information that's easy to use. So they are here today to talk with us. So they get to present in just a little while after we get through our normal agenda. And yeah, so we're just going to go through our member announcements and then have that discussion. We'll talk a little bit about next steps, but let's take a moment. I think, Amelia, you are new, so we always like to ask anybody who's new to this group to introduce themselves out loud, if you don't mind. And everybody else, if you would just put your name, organization, and location in the chat so we all are reminded who's who. But yeah, Amelia, welcome. I'm so glad you reached out.
Hi there. Can you guys hear me okay?
Yep.
That's wonderful. Thank you. So my name's Amelia Marchand. I am joining from near the Colville Indian Reservation on the lands of the Moses Columbia tribe and the ancestral lands. And I'm the new interim ATNI Senior Tribal Climate Resilience Liaison. Bit of a mouthful. So I work with Chaz at ATNI. Many of you will recognize his name. And I apologize if I'm a little bit slow on the uptake. It's been a pretty busy week and a half trying to like catch all the different meetings that are going on. So if I ask a question that is gonna reiterate something you guys have already gone over, I apologize, but I'm probably gonna do that a little bit. So thank you for having me. I am outside. I should have gone inside today because my allergies all of a sudden just started like kicking into high gear. So I am going to be muted as much as I can so you don't hear me sneeze and stuff.
Well, we're super glad to have you. We love to work with ATNI when we can. So great. So, this is typically facilitated by me. I'm Angie Hager, Prosper Sustainably, and I work with Shasta. Shasta is with the Paula Bandam Mission Indians, and she's their environmental director and the program administrator of the Tribal Climate Health Project, which she has hired me on to help with. And so we are sort of co-facilitating all sorts of stuff through the Tribal Climate Health Project, including this work group. So thank you all for continuing to come. I don't think anybody else is brand new except our Healthy Places Index folks, but you're going to have a chance to introduce yourself in just a minute. Okay. All right, member announcements. Just give a space here for anybody who wants to share any news, anything related to tribes, climate change, adaptation, and health, especially on the data front. What's new?
Well, I'll start with just the usual, reminding folks that we're having our Tribal Climate and Health Adaptation Summit in Paula in just a little over a month. And I just wanted to give the update that we've had a really terrific response, and we had decided to cap the enrollment because it's a training and we want to be able to focus on as many folks as possible. So we decided on 50, and not only did we get our 50, but we probably have about 10 people on our waiting list right now. So, and the thing that's even more exciting about it, although maybe not exciting for some of you folks who don't work for tribes to hear, but we had enough tribal interest that every single person we accepted actually works for a tribe. So even though we had a bunch of folks who said, well, I work for, like one example is the Minnesota Department of Public Health, and we want to work more with our tribes, because this is nationwide. We had enough tribal folks who are tribal environmental directors, tribal public health folks, tribal even I think somebody who's in their social services department, that, you know, that we were able to accept all those people. And I just sent sort of an apologetic wait list email to the others saying, just we're focusing on as many tribal folks as we can get. And that's what we got. So I'm very excited. And that includes several folks coming all the way from Alaska. So yeah, it's really, really glad that we've gotten so many people, and we'll of course report back on how it went in one of our future meetings. And what else is going on? In fact, Amelia and Sharon know about this because they were on the ITEP call yesterday, the Institute for Tribal Environmental Professionals, but the National Tribal and Indigenous Climate Conference, or the NTIC, is taking place at the end of August / beginning of September. And that's going to be in St. Paul, Minnesota. So that's something worth considering coming out to. I believe that they've already cut off the date for submitting a proposal to present, but that doesn't mean that you can't still go. And so registration for that is going to be opening soon. So I would encourage you to consider coming to that if you're interested in tribes and climate change. And let me put, I'll put some links in the chat.
Thanks, Shasta. Hey, Ben, glad to see you. If you want to put an intro in the chat, just to remind folks who you are, that'd be wonderful. We're doing member announcements right now. Anybody else?
If you didn't come, you missed the best meeting ever at Paula. Was seriously the best meeting. I hate meetings. It's the best meeting I've ever been to.
Whoa.
It was so great. The Southwest Tribal Climate Change. It was amazing.
Well, tell us what made it so good.
Shasta arranged for the beautiful temperatures that she promised. It was in the 70s with a light breeze. It was, the people that came were amazing, including Sharon. And it, you saw climate change in ways that I've never seen it before. I mean, one of the things was we did a walk, and there were people that spoke Hpi, people that spoke Kumeyaay, people that spoke Kupa, I believe, and Spanish. And so they were translating what we were seeing back and forth through all these languages. So you saw a picture of how the climate is changing through a linguistic lens, because somebody would say, oh, we don't have a word for that, but that's here. We should have a word for this. Why don't we? Oh, this doesn't usually grow here. Oh, it grows in our area. We're further south. Oh, you must be getting hotter because now you're seeing it here. It was fascinating. The whole thing was amazing.
And I will add that the fact, Lori mentioned that, the weather was perfect, and that mattered because we were outside. The whole thing was under a tent, which made for just, it was, you know, that was the point, like to be outside in the world, and to relate to the weather and also to relate to the people. It was not structured in a classic, you know, presentation panel. There were panels and there were presentations, but it was there. It was much more about relating to each other at the event. So so it's great to see you again, Lori, now that we've met in person also. And
Yeah.
of course, you know, we were all just so relieved to be live with each other and hug each other and things like that. So
Yeah, and the
if you don't know
panels,
me, I'm not always so effusive, but it was beautiful.
yeah, when people were done talking, they didn't just drone on for another 20 minutes because they had another 20 minutes scheduled for them. They stopped and we moved on to something else. And if something needed more time, it took more time. I've never been to anything that great.
It warms my heart to hear that from both of you.
I have FOMO because I wasn't able to be there with some of my favorite peeps, but good job, you guys. This sounds awesome.
It's a model, Angie. And
yeah.
so we'll keep doing it.
Yeah, I mean, for folks that are kind of new to us, you know, we're on the capacity building side of things. So I would love to hear more about what worked well. Okay, what other announcements do folks have? I have just a couple questions for the group before we move into our speaker.
Do you want like just updates on what we're up to, or do you want like general purpose, here's a conference, you should all know about it stuff?
Just knowing that we're all trying to solve the problem of data access when it comes to adaptation for tribes, if there's anything in particular that others would benefit from knowing about, would be a space for that. I
am working, since I'm unmuted, I'll go ahead then. I'm working on a project that's related to that. There are a tremendous number of indicator systems about vulnerability that are out there. And it's questionable how effective they are, especially with regard to reflecting tribes. And I've been working with a student at the South Central CASC to start analyzing the results of them within the Rio Grande Basin, to look at, you know, what they're saying about which are the historically marginalized communities and also how they reflect the tribal data. And I just got some funding to also do it in Oklahoma. So I'm kind of excited about that. So when I have some results, I'll be happy to tell you what they're showing. One of the things that's out there right now, of course, is the beta version of the Climate and Economic Justice, something that starts with an S, tool, which is being used for the Justice 40 initiative. Yeah. Which is highly controversial because it doesn't even include race. And if your tribe happens to be in a, you know, overlap with a census tract that doesn't, you know, has a lot of non-tribal folks in it also, then you're not necessarily going to show up as being vulnerable, which means you may not get the Justice 40 money, which is a little freaky. So yeah. Oh, Amelia, go ahead. That's part of the analysis.
Amelia has a question.
Yeah, thank you. I'm sorry. Can you clarify? You said it doesn't allow for what measurement or for what identification to be?
Race. Race is not part of the CEJST. They didn't put it in there because they were afraid of lawsuits, which
they're legally unallowed from having race be an indicator for where they make investments. That's my understanding.
Okay, that is better than just being afraid of lawsuits. Thank you for that clarification, Angie.
Man,
however, they're getting a lot of flack for it, so I don't know where it's going to end up.
I think this is a very related topic for us. We had Kellen Viroscreen present, if you remember. It's a similar kind of an effort to try to map where are the people that need help, who are the disadvantaged communities, and where are they, so that we could try to target our investments to it. It's has so many implications, and now there's all these other species of the same kind of thing starting to happen. So it's like, how do you figure out who are the communities of need? I mean, I think we could have a whole discussion about that sometime. because tribes are often left out from my experience until something like, Cal EPA, OEHA has had to go through a lot to figure out, to get to the point where they just recently designated all tribes, at least with reservations, are now considered disadvantaged communities and have access to all these investments where they didn't before.
Right. And in my research, I'm trying to figure that out. And I'm just going to include all tribes. Like, that's not a problem for me and the communities where I'm doing research. But we'll still be looking at all these different indicator systems, some of which have been around for a long time. And I, of course, I'm not in California, so we don't have all, the same tools that you may have there. But I think it'll be a good, a good comparison, and will hopefully be a good model to keep doing more of that.
Well, love to have you present at one of these someday. Lori, go ahead.
On the Cal Enviro screen topic, if you work with a tribe or you are with a tribe who doesn't have an accurate tribal boundary in Cal Enviro screen, please let us know. We can fix it now. We have permission to fix it. So if your tribe has fee lands, if it has any other lands not in trust, we can fix those mapping boundaries so they're accurate for their tribe. We can make them smaller than a census tract. We can make them larger than a census tract. So just let us know.
Amazing. I want to just ask the Hive brain a couple questions. You guys saw my email. We're going to be applying for another round of tribal BIA tribal resilience grant funding to continue to do this and a lot of other stuff that the Tribal Climate Health Project does. One question I have is, do any of the folks listening now have people that they would say that they would point us to, experts in data scientists or otherwise an expert in wildfire smoke illness or groundwater basin or basin levels? And I know DW, Department of Water, but we're looking to get something a little bit more surgical, get to indicators at a little more surgical level. So groundwater, wildfire smoke illness.
We're doing an indicator for the report on wildfire smoke illness. And so that might be helpful. If you need something like now, I can ask Carmen if I can send you a copy of the draft, as long as you don't like release it or cite it, because I might still have typos. Typos.
It may be just that I really want to partner with you.
Okay.
So, okay, I'll connect with you after.
Hi, this is Neil Maslich. If you're looking for clinical experts, John Bombs at UCSF is one of them, as well as Jason Vargo, who's actually now at the Federal Reserve, but he was at CDPH. Yeah. Still might have an interest. Paul English, who's retired from CDPH, but is now a principal investigator at the Public Health Institute, which is our same, meaning the Alliance, our same parent organization. So they have all weighed in on wildfire smoke illness over the years, have done epidemiologic studies, and have actually, especially Jason, looked at smoke days as an indicator of wildfire risk.
Okay.
More recently. So those are a couple of folks who are on the public health side who've done work in this area.
Yeah. So yeah, where we would like to look at it from both respiratory illness perspective and possibly also water contamination, debris. So yeah, awesome. Thank you so much. And we actually normally have a Samu from CDPH on these calls, so maybe he'll even come. Okay.
What's the groundwater question you have?
It is really difficult to give tribe, if you're working with a tribe trying to do an adaptation plan, it is really challenging to find data that can help them understand where the trends are going with their groundwater data. So there are tribes for which some have the access to doing some kind of a hydrological study on their own. And if not, maybe they're tracking their own well water levels, stream water levels. But there isn't a good publicly accessible source that has regular station data to establish trends. There's certainly no projections. And so I see this as a giant area where tribes are at huge risk and there is a blind spot. in terms of how quickly and how devastating their water security is going to become.
Amelia, you had unmuted for a second, I think.
I did, because I was kind of going to ask the same question. One of the things that everybody probably on this call knows, with all the frequency of fire return intervals and the expanding sizes, it's not just the infrastructure or the landscape that's burned, but it's all the other fire retardant chemicals that are still being used, and it's an increasing amount of fire retardant chemicals on the landscape. And those are, some might be considered not to have negative impacts, but over long term, as frequently as they're being used, I think that's a big unknown as well.
Have you guys been in touch with Tony Westerling at UC Merced? I mean, he doesn't do the water piece, but he's modeled. His models are behind the CalAdapt fire risk assessment, and even though he doesn't do the water contamination part, I suspect he would know who does, and through his network. So he's just a professor at UC Merced, and you can look him up that way.
Okay. You should probably keep coming to these meetings. You got a lot of good contacts.
Well, I used to work at CDPH and was partly responsible for the founding of the climate and health program there many years ago. So I actually have a background in climate and health modeling, and
awesome,
as well as working on the Healthy Places Index.
Yes, well, and that's probably a good segue. We need to make sure we have lots of time for that conversation. Is it okay with everybody if I transition?
Yep, just really quick, USGS and state GS would be where I would start personally for groundwater information, but I'm guessing you've already done that.
I find everybody sends me to USGS, and then it's never, I never can quite get what I need. You know what I'm talking about? Okay.
So yeah, because out here it's the Ogallala Aquifer, and it's as well as any aquifer is modeled and studied and everything else, but it's huge, right? And so an individual tribe on a smaller aquifer, yeah, that's a tough one. I totally agree. There are some NASA tools now, but we'd have to get NASA involved to talk about fluctuations in that. I don't know about outlooks very well. It's just not my expertise.
Yeah, look, getting location specific would be great, but we'll take a proxy. We'll take the best proxy we can to get some level of trend understanding. Okay, thank you, everybody. That's a good teaser for the meeting that I want to that I put on your calendars for July 1st. You are not required to come, but if you will, we are looking for more advising on tribal gaps like these and how we can help fill them. And I think you guys are going to really be able to help us there. So we have a lot more information now than before about where we think the really high priority gaps are. Okay, so with that, today's speakers are from the California Healthy Places Index, actually from the Public Health Alliance of Southern California. So we have Heather Dowling, the data manager, Neil Maislish, okay, Senior Data Advisor, and Alex Nikolai, Program Associate. Thank you all for being here. I'm excited. I'm going to stop talking and you guys have the floor, then we'll get to discussion. So everybody be banking your questions or throw them in the chat. I'm going to you are a co-host, Helen, so you can go ahead and share.
All right, great. I'll get the presentation up just a moment. All right, see the presentation?
Yep.
Okay, excellent. Well, hi everyone, and thanks for having us today. My name is Helen Dowling. My pronouns are she and her, and I'm the data manager at the Alliance. So I'm joined today by Neil Maislish and Alex Nikolai, who also work at the Alliance, who are also here to help contribute to the discussion and help out with answering any questions that might come up as part of our Q&A. So this morning, I'm here to talk about the California Healthy Places Index 3.0, what it is, what it does, and how you might use it. So first of all, I want to introduce Public Health Alliance of Southern California. If you're not familiar, we're a coalition of the executive leadership of 10 local health departments representing more than 60% of the state's population. We're fiscally administered by the Public Health Institute. We're also architects of the Healthy Places Index, which is why I'm here talking to you today. Before I get started, I wanted to ask who here is already familiar with the HPI. If you could just raise your hand so I can take a look. All right, great. So for those who aren't familiar or would like a bit of a refresher, I wanted to start with a bit of background. So why the Healthy Places Index? Decades of research tells us that our life expectancy and well-being are tied to the community conditions in which we live, which includes the existence of racially driven laws and policies. We know that access to social conditions that support health, what we call the social drivers of health, education, good job opportunities, and healthy food and water, for instance, vary drastically by neighborhood for a complexity of reasons. More specifically, we also know that systemic racism is a major barrier to health. Communities of color continue to disproportionately experience negative economic, environmental, and health outcomes due to racist policies embedded into our systems. Our team at the Public Health Alliance operates with the understanding that in order to create lasting systems change, both race and place must be recognized and understood. It's for these reasons that we created the Healthy Places Index tool, which launched in 2018. The HPI was expressly built to highlight community assets and strengths using a positive frame that can be mobilized to implement solutions. The HPI maps neighborhood level data on conditions that drive health, layered with racial justice data and resources, and provides community specific policy recommendations to advance health equity. So what does that look like? The HPI scores and compares neighborhoods across the state based on how healthy the local social conditions are. The tool does this by evaluating the relationship between 23 key social drivers of health tied to life expectancy at birth. The HPI produces a score representing the relative rank of community conditions in a selected area, which can be filtered by a range of geographies, including census tract, zip code, city, unincorporated areas, and more, and compares it to all other such areas in the state. Our data and policy recommendations are organized by 8 key policy action areas that you can see on the screen now. And if you're interested in a deeper methodological dive in how we constructed the HPI, I would be happy to link you to our technical report. I also want to share a little bit about our race and place framing, which is implemented throughout our HPI 3.0 tools. We know that factors of both race and place are proven to acutely impact health outcomes. We've updated the HPI platform on the premise that lasting systems change cannot occur unless leaders, community providers, advocates, and residents themselves understand the critical relationship between place, race, and a person's health outcomes. We were intentional about enhancing these features in the update. The ability to analyze impacts of race and place on the HPI 3.0 map platform affords insight on the specific needs and conditions of each community. That additional insight allows you to develop more equitable interventions, programs, and allocations of resources and funding. It also ensures that these resources are scaled appropriately to each region, and these enhanced data and tools help communities better advocate for their own needs. All right, so who can use the HPI? Well, really anyone. We made the platform free, accessible, and it's designed to be easy to use to ensure fair and open data available to all. While we've already seen many sectors engage with the tool, here are just a few that we have found who found HPI to be useful in their work. Since our launch, the HPI has become a go-to data tool for hundreds of state and local government agencies, foundations, advocacy groups, hospitals, and many others. The tool has been adopted for various uses, addressing critical community needs like active transportation projects, affordable, stable housing, food security, climate resilience, and of course, the health equity metrics that influence COVID funding and support, which is where many people heard about the HPI for the first time. So we're proud to say that the HPI has been used to inform the distribution of over $1 billion to community-focused investments, including $272 million during the COVID-19 response to communities that were most impacted by the pandemic. So now for the fun part, I'm going to talk about the mapping platform. Here are a few of our core features. You can access information about communities, including HPI score and indicators, and detailed race ethnicity measures, including subpopulations and national origin data. You're able to view hundreds of decision support layers, including projected climate change impacts like extreme heat, adaptive capacity measures like impervious surface cover and tree canopy coverage, along with measures of health outcomes, housing stability, park access, in addition to over 30 measures disaggregated by race, ethnicity, or language. You can also generate HPI ranks within a city, school district, and more to answer the question, for example, of how communities in your county stack up. You can also create custom geographies to aggregate data for communities or project areas of interest that are not offered in the pre-selected geographies. And in our HPI 3.0 update, we built in a set of brand new features that include a function to compare data across geographies and time periods. So this gives you the opportunity to track improvements or declines in a community over time. You can examine the link between race and place. You'll be able to assess how measures vary by race and ethnicity and explore the race and ethnic demographics of communities you live and work in. You can filter geographies by race, ethnicity, and country of origin to identify small or geographically dispersed populations. You can receive policy recommendations tailored to the specific needs of your community, supporting moving neighborhood data into action. And you can view historically redlined neighborhoods, a policy that was in effect from 1935 to 1940 that has had long-lasting impacts on communities across the state. So while I'm here today, I want to talk about tribal data and coverage in the HPI. So I will recognize that we're, I think, in early stages in addressing some of these data challenges. As a first step toward providing more detailed data on American Indian and Alaska Native populations, we now show overall and tribal group population counts. So these are ones that are reported by the American Community Survey. We break those counts down further, so giving people the option to look at the American Indian and Alaska Native population alone, or American Indian and Alaska Native population in any combination with other races. We also provide an overlay layer of American Indian area boundaries and population in California, which I'll show you shortly. And we also took a look at the HPI coverage of tribal areas in California. We're happy to say that nearly all have at least partial coverage, providing HPI data on neighborhood conditions for these communities. And we can talk a little bit more in the discussion time about potential implications of those places that don't have data coverage. So I've just listed a whole bunch of things that you can do on the HPI map. In the interest of time, I'm not going to be able to demonstrate all of them today, but I wanted to focus on showing you a handful of features that I think you might find especially useful in your work. So the first feature we're going to explore today is how to turn on an overlay of the American Indian area boundaries and population counts in California. So we could use this, for example, to answer the question of where the reservation lands in northern coastal California are located. So here to do that, you'll access our tools menu on the map. First of all, I'm taking a look at Northern California. You'll click the View Indicators function and scroll down. You'll see a lot of different categories of information here, but what we're looking for is the population in American Indian areas layer that's located under the overlay category. So now I'm going to zoom in a bit more so you can see this better, but the areas in purple are the population American Indian areas boundary layer. So what you'll see when I hover over these places, You'll see the name of the tribal area as well as the current population count. You might be interested to access specific information about your tribal area. So with the HPI map, you're able to not only see the overall HPI score of your community, but you can also investigate the individual HPI indicators within the policy action areas. You can use the community conditions panel to be able to see how your community compares to other communities across California and what factors impact health, equity, and outcomes. So for example, this can be used to see how the Palo Reservation compares to the rest of San Diego County. To do that, you can go ahead and click on a community of interest. So here we're clicking on the census tract that has the Palo Reservation. You can see that the tract that it's located has healthier community conditions than only 28.5% of other tracts in California. It's a little lower than the county average. You're also able to click through different policy action areas that you can see here to reveal the HPI indicators and the percentile ranking of each compared to the rest of the state. You can also explore the demographic breakdown of information for this census tract, including detailed breakdown of a race ethnicity composition. You'll see the little arrows next to each of the overall groups, and that will give you more detail if you were to click on them. The level of detail that we provide on race and ethnicity and national origin is important, especially if you work with or serve a specific population like an American Indian tribe. We know it can be difficult to find the neighborhoods where your population lives, especially if they're small or geographically dispersed. We have a feature designed specifically to find priority communities. It's called our filter by race ethnicity function. So for example, we could use this tool to find where people who are in the Cherokee diaspora live in California. To do that, you'll go to our tools menu and select the filter by race ethnicity function. You'll see here you can select groupings by race alone or in any combination. I've selected the or in any combination grouping, and I'm going to scroll down to Cherokee. By default, it's going to filter the map to only show me those places where at least 100 people have identified as Cherokee. Down here at the bottom, you can change those filter criteria. So you either change the number of people that we're looking for. In this case, I'm changing percent of the population. So I only want to see those places where at least 2% of the population identify as Cherokee in any combination with other races. We included extensive policy guides in HPI 2.0, which we then expanded in HPI 3.0, which incorporates a new evidence-based rating system using the CDC framework. And it's really one of the key components of our platform. We really want people to be able to take data into action. Our policy guides represent a great resource, but it can sometimes be challenging to identify the best actions to take in your specific neighborhood or project area. In our platform, we've built all of our policy guide content directly into the map, and we've also developed a tool that elevates the policy opportunities that could have the greatest impact in a selected community. So let's take a look at an example of that now. To access the full policy guide content, you go to the tools menu and click policy opportunities. You'll see a list of all of our guides, which you can then click through to explore in greater depth, including reading about the connection to health, some quick start ideas, as well as individual policy actions that I'm demonstrating here. You can also see that evidence rating piece that I just mentioned. Alternatively, you're also able to select a community. So let's go back to that census tract we were looking at before. If you select a community, then go back to the tools menu and click on policy opportunities, the map is going to automatically elevate policies that could have the greatest impact in this specific place. It's an excellent way to find ideas for action in your community and allow you to explore further. Finally, I want to share that our map is not the only place to view our policy guides. If you wanted to explore those guides in more detail, our new policy guide website, so URL is there, policy.healthyplacesindex.org, is an accessible tool to dig deep into our policy opportunities. It showcases our 31 guides in easy to read searchable format, and our website allows you to quickly access the evidence rating for each of the hundreds of policy actions we include in our guides, along with sample ordinances, links to relevant reports, strategies and plans, templates, resources, and more. Guides are available for every indicator in the HPI, along with 8 of our decision support layers, and several of those are climate related. So highly recommend checking that out. So, and with that, I've appreciated the opportunity to be here to share what is really only a very brief sampling of what's included in the HPI. The best way to learn more about it is to dive in and explore it yourself. And I want to say that we are constantly looking for ways to improve the HPI, particularly when it comes to tribal data. So we know we've only just started to address some of the challenges in this area, and we really value your thoughts and feedback. Please don't hesitate at all to share them with us. I would love to have a conversation about it. And any other thoughts that you have around making the HPI even better. It's this community feedback that has really made HPI what it is today. And again, we really value your input. You're also invited to connect with the HPI Community Hub on our website, where you can sign up for our newsletter, you can request trainings and consultations, you can take a look at our technical documentations, and I also want to mention that our website also has video tutorials if you'd like to learn more about how to use specific functions of the HPI that I wasn't able to cover today. I'll leave a link to all of that at the end of the presentation. So with that, I'm happy to take questions, comments, any thoughts.
Just so smart. Okay, beautiful. I wonder if you could do one more thing on the demo, which is could you actually show the climate indicators in that decision layer?
Yes, just a moment.
I should just say that the origin of these indicators are the same as the CHIVIs, the climate health vulnerability indicators that CDPH developed, and you know, and sort of truth in advertising. I was the brace coordinator at CDPH, and with Paul English, we were the ones who developed this over time. And then after I left the State Health Department in 2015, the Alliance actually got a contract to update these. So these are now updated as well, but they are the same as the climate health vulnerability indicators that CDPH developed. And just a sort of a shout out to, is it Sharon, around, you know, the proliferation of indicator projects. There's sort of a cautionary note about that. It's really about framing, and each one is really different, even though there's overlap. So if you look at our technical report, and actually an article that we wrote that was published in Public Health Reports in 2018, I think it was, where we actually do, you know, we erect 2x2 tables looking at the most disadvantaged quartile of different indices, and we compare them. And it's actually more effective looking at that and then mapping the census tracts that are concordant and discordant. We did this with CalEnviroScreen. We did this with, you know, the SVI and a number of other popular indicators. And when you just do, you know, interclass correlation coefficients or simple piercing, you miss actually seeing the number of census tracts and the populations that are discordant. So when you start doing your work, you might want to take a look at what we've done, because we get this all the time. Like, how is the HPI different or similar to other indices? And we find, like for CalEnviroScreen, of the, you know, the top quartile is going to be roughly 1,900 census tracts in California. So of those, roughly 650 are discordant in the CalEnviroScreen, and the, you know, and then there's a large amount that are actually concordant. But when you look at, you know, what is all about the discordancy, well, it's the specifics of the indicator. So if you're more oriented towards pollution, well, of course, those that score higher in pollution are going to be in CalEnviroScreen, and they're going to be less in the HPI. And conversely, ones that emphasize the social determinants of health are going to be more represented in HPI than CalEnviroScreen. So each indicator, you know, project's framing is really important. So that's partly why there is such, you know, apparent discrepancy among the, because, you know, even though they share often, you know, maybe half or more of indicators that are same, there's these the differences actually direct you to different places. So HPI has a far less urban bias than CalEnviro screen because of the nature of the selection of the indicators and things like that. So that will have implications for American Indian populations as well. Anyway, I just wanted to mention those things because we've looked at it and it may help you as you go forward in some of your research. Helen, back to you.
Lori has her hand up.
This is such a pretty tool. I know that isn't supposed to be the first choice, but I like that it's very pretty. And I was trying to follow along with you and do it on my side, but I got lost really quickly. Can you tell me more about the excluded areas? I was curious about those and I couldn't find it clicking through.
Yeah, so happy to share a little bit more about that. So we have inclusion criteria for HPI scores. So essentially, if the census tract has greater than 1,500 population, we include it, as well as it has to have less than 50% group quarters. So we do this to ensure statistical reliability of the estimates, partly with the population size. And then the other piece is that we don't want to accidentally capture things like college dormitories, right, where the population may appear temporarily, appear more impoverished than they actually are, for example. And we also see some strange things that happen when you have census tracts with large populations of incarcerated folks, as well as nursing homes and assisted living facilities as well. So that's
why that San Quentin is what excludes that area in Marin.
Yeah. So those are the two considerations: is population size and group quarters population.
Interesting. Thank you so much.
Mm-hmm.
That raises another question for me, if it's okay.
Yes.
Yeah. So those are still, I mean, significant populations to consider. I'm thinking of like epidemic, emergency response, preparedness. Are those things that can still be identified, or is this just not the platform and tool, to look at those components or aspects of the population?
Yeah, I think it's a really great question. And let me specify that our exclusion criteria is specific to the HPI. So we actually have hundreds of decision support layers that are not held to the same criteria that those indicators and the overall HPI score are held to, which means that in many cases, you'll get broader coverage with some of our decision support layers compared to some of the individual indicators in the HPI. That said, we're running into a little bit, I think, particularly if you're looking at the map right now, there's a little bit of a visual prominence bias that's happening. So you're seeing some areas here that, look like large swaths of California don't have HPI scores. But these are places that don't have as high of a population. And I think, I can't recall the number off the top of my head, I believe it's something like 97% of California's population is covered by HPI eligible census tracts.
Sharon, did you want to ask your question?
Yeah, I was just curious, and I put it in the chat, which may not be visible to you while you're sharing your screen. If the exclusion criteria on the census tract means that a lot of tribal tracts would end up being excluded because they may not have that, they may not have the 1,500 population. And I recognize that if you still have the tribal boundaries, it may not really be an issue. But then if you're comparing across tracts and you're losing a lot of tribal tracts because they don't meet the population cutoff, that's still tricky. So I'm curious about that.
Yeah, no, and thank you for asking about that. We actually looked at that specifically because I think that was the concern of ours as well, is to make sure that we have good coverage So we have at least partial coverage. So that is at least part of the tribal area is covered by an eligible census tract for 95% of tribal areas in California. So there are 5 tribal areas. So there are 110 in California, and we have coverage for 105 of them. So there's 5 that we don't have, that don't at least have partial coverage by an eligible census tract. And actually, this is one of the things that I wanted to bring up, because I know one of the recommendations that CES recently made was around, if we don't have data, or for the tribal tracts, they automatically go into the most disadvantaged designation. And that's something that it's my understanding as well, that CDPH is taking the same tack, using HPI quartile 1, rather designating those places without an HPI score as quartile 1 for purposes of resource allocation. And so that is a solution to this, which we, I think, also agree with and support that approach. And I'm curious if there are any thoughts specifically about that. You know, we're kind of running up against the challenge of perhaps not having as good access to data as we'd like. We'd love to be able to provide 100% coverage of tribal areas, of course. But as an interim solution, just saying all tribal areas will get that, if they don't have data, get that designation of, you know, most disadvantaged for purposes of resource allocation, right? You know, we try really hard to maintain a positive frame and asset-based framing, you know, so for us, we don't want to sit here and, you know, explicitly state, yes, all tribal areas without data are considered disadvantaged. But that's why I add the caveat, for the purposes of resource allocation specifically.
Can you tell me on the resource allocation? I didn't know HPI was being used in that way. So there are California government agencies that are using HPI to allocate resources. Like what? Can you give me an example of like what kind of resource would they allocate based on this? And I guess secondary would be, I was under the impression that the race data point could not be a factor, but tell me about that.
Well, so both of those questions have potentially kind of long answers, but I'll try and keep it generally short. So we've seen use of HPI just truly across the spectrum at both the state and the local level. So, I mean, the most highest profile use I think of HPI has been around the COVID-19 response, right? Where HPI scores were taken into account both for the blueprint reopening criteria. So ensuring that places with fewer health supportive community conditions weren't falling behind. We wanted to reduce the disparity in infection rates. Similarly, I think, you know, it was also used as a way to, very early on in vaccine distribution, HPI was used to direct vaccines. And then from in other sectors as well, so it's more public health related, again, higher press, I think, about that. But it's also been used for at the Transforming Climate Communities grants, which I believe is a state program as well.
Yep.
I can go ahead and take a look at the use case. We have a use case tracking sheet that I would be happy to just pass around for the group to take a look at as well.
I mean, another biggie is the active transportation program, where you know, the applicants that get preference have to demonstrate disadvantage in their community. So, you know, along with Cal and Fire Screen and a couple other indices, you know, it's one of the ones that are suggested to be used for demonstrating need. And you know, we as Helen mentioned, there's hundreds of use cases that include both local government, regional government, as well as the healthcare systems and a broad array of other folks that have used the HPI. Some of it is for citing services, and some of it is internal prioritization, like a number of local health departments are using the HPI for targeting mental health services and a whole range of other kinds of activities. So it's pretty broadly used now in a lot of different settings. We keep hearing about use cases all the time because we're a small organization, but occasionally someone Googles it and finds out that it's being used for citing mobile units going out into the community to improve vaccine coverage for COVID, things like that.
So, I want to transition more specifically to climate change, but does anybody want to say something, ask a question or make a comment before I do?
I had one comment in the chat, or one question in the chat. How does the platform reconcile the needs of communities along California's jurisdictional boundaries, where data may stop at that border and therefore it might not adequately portray or capture the needs of those communities?
Are you talking about county borders or state borders or national borders?
So my understanding is this tool is only for the state of California. Is that correct?
Right.
For now, right? Or is there any plans?
Well, actually, we are working with the state of Utah right now to develop a HPI for them, and we have aspirations to be national. So we've created the data infrastructure to get that established, but we don't have enough resources to do a national version of, we're a tiny nonprofit. It's not like we have a huge staff.
So, well, one of the things, not just for population data, but also all sorts of climate modeling, habitat shift, landscape change, water use. For Washington State, where I am, all that data stops at our northern boundary with British Columbia. Right. So that's one thing that we've been trying to work on because reality doesn't care about that. So thinking of the state of California and all the different boundaries that it has, that external boundary, I'm wondering, for climate change, for everything, how is that?
I think the good news is that many of our indicators are national, from national databases like the American Community Survey. So the ability to create or recreate the HPI and many of the decision support layers is actually not only quite possible, but we leveraged that for our work in Utah. So it could be translated for Nevada and Arizona. Mexico would be a big challenge, but Oregon would not, because that's same national data. So we have some of those same limitations, but that's part of our original criteria for picking a particular indicator in the HPI was that it would be publicly accessible and have really good and complete geographic coverage for California. So that turns out to have been a big advantage when it comes to the ability to parlay what we've done to other states, because we're using publicly accessible data. So we have like 8 or 9 different data sources. About half our HPI indicators of those 23 that Helen mentioned, about 12 of them come from the ACS. Then there's very specific ones. We rely on, we have folks from OEHA on the line, but we rely on the CalEnviro screen for several of our environmental indicators around diesel PM and PM 2.5 ozone and in the drinking water contaminants. So some of those things can be looked at, nationally as well. But it is.
We hope you are funded to do so. Let me just make a couple points on climate change, and then we have to close out. Sadly, we need more time. But It looks like there's no projections. And so I'm curious if you're thinking of adding projections, and I'm curious if you're thinking of adding health impacts of climate change. When I use this for tribes, when I'm doing an adaptation plan, I'm going and looking at whatever the closest boundary is to them. I'm using whatever data I can. I peruse all around. Sometimes things that are not considered climate change, I consider, like food insecurity. You have a lot of cool stuff in here, and I just kind of take what I can to try to understand vulnerability. So it's really I use it to try to understand vulnerability among 1,000 other tools. So yeah, I'm interested if you're trying to grab more data sets on climate change, whether it's exposures or impacts, and if you're thinking about projections.
Yeah, so we include a couple of sets of projections. I mean, we do include some heat. So we have a number of heat projections, days above 100, days above 90 degrees, both at mid and end century. So we have a couple of heat projections there, and we have aspirations to expand the number of climate exposures that we include. So things, I mean, we have a measure of sea level rise or population sea level rise inundation areas, but I mean, other things like more precipitation, wildfire risk, pieces along those lines. I mean, I think if the data were there, we would love to incorporate it as well. Yeah. And while we have these two categories, we have our adaptive capacity and exposure measures, as you mentioned, kind of throughout our decision support layers, we actually include a lot of other community conditions that can essentially cover resilience to climate change. So things like tree canopy coverage, park access, those pieces. For projections, I believe we also have projections, demographic projections, so changes in the population pyramid. So, you know, where you're going to see changes with more youth, more elderly populations, projections around workers exposed to extreme heat. I would be remiss if I didn't mention a sister tool that we worked on with UCLA called the Heat Edition of HPI that really forefronts specifically extreme heat, projected extreme heat exposures, and looks at that intersection of HPI score, community conditions, adaptive capacity, sensitive populations. So that is going to have a public launch in a couple of weeks here. And we would be happy to flag that, you know, to dive a little deeper if you want to take a look at that.
Well, I would love to follow up with you after this and tell you a little bit more about what we know in terms of what tribes need on the adaptation side. So, but thank you so much. I'm going to let people go because we're over the hour. I really appreciate everybody's time. Thank you so much to HPI folks for coming.
Thanks, Helen. Thanks, Neil. This was great. Really informative.
Keep up all the good work. I talk about you guys all the time.
Thank you.
Thank you. Have a good day.
All right. Bye.
Bye, folks.
Thank you.